Hi, my name is Mary and thank you for joining us for the 2 Foot Adventures product series. Today's video is going to be on Blister Care. The first product I'm going to talk about is the mole foam padding. Many people are familiar with moleskin. Moleskin is very thin. The mole foam padding, if you can see it, I'm not sure, but you can see there's a lot of thickness there. The best time to use mole foam padding is when you have a blister that's already developed. One of the techniques you can use is to cut a hole in the mole foam padding that will go around the blister, kind of making a donut. And then the padding is there to allow pressure to be distributed around the blister and take some of the pressure off the blister. One of the primary ways that we use this to help hikers is when treating bottom of the foot blisters, which happen usually when you're hiking a little bit too much too soon. So commonly you'll get blisters right here behind your toes. Imagine this is my foot. So right behind the toes, people will start to get blisters in this general area. So one of the best things to do to treat this so that you're able to keep hiking is to, if this is your blister, you will cut mole foam padding to go around it in a U shape, or at the very least a bridge across it. And then to put the mole foam padding to keep it in place, we usually use Leukotape. So Leukotape is really sticky. You might have seen it if you've seen other hikers treating their blisters. It comes in this big roll. It's really sticky, it's waterproof, and usually if you put Leukotape on your skin, it can stay there for sometimes up to a week, even with hiking and showering, because it's super sticky. And that will help keep the mole foam in place while you're hiking. And you can also use this to treat blisters, but I would not put it directly on a blister because the Leukotape is so sticky. If you need to pull it off, if you feel like there might be an infection or something like that going on below it, the Leukotape can actually rip the skin off. So in that case, I would use something more like moleskin to protect just the top of the blister if you're going to be needing to tape it, and then put the put the Leukotape on top of that, but don't put Leukotape directly on a blister. So those are my blister treatment tips for today.